Hi everyone, Happy New Year. Welcome to this health corner of Ardua Veritatem this New Year 2021. We will continue our discussion on the comparison between flu and COVID-19. What are the signs and symptoms of flu and COVID-19? Both flu and COVID-19 have varying degrees of signs and symptoms, ranging from no symptoms, that is, asymptomatic, to severe symptoms. Common symptoms that they share include fever with or without chills, cough, sore throats, runny nose, congestion or stuffy nose, muscle or body aches, headache, fatigue or weakness, nausea or vomiting, and diarrhea. Signs and symptoms peculiar only to COVID-19 are the change in or loss of taste or smell. Similar complications of flu and COVID-19 include pneumonia, respiratory failure, acute respiratory distress syndrome, sepsis, cardiac injury, for example, heart attacks and stroke, multiple organ failure like respiratory failure, kidney failure, shock, the worsening of chronic medical conditions involving the lungs, heart, nervous system, or diabetes, the inflammation of the heart, brain, or muscle tissues, secondary bacterial infections, that is, infections that occur in people who have already been infected with flu or COVID-19. Multisystem inflammatory syndrome in children also occurs in COVID-19 infection. How is flu diagnosed? How is COVID-19 also diagnosed? Reverse transcription polymerase chain reaction or viral culture of nasopharyngeal or throat secretions is the criterion standard for confirming influenza virus infection. But majority of cases of human influenza are clinically diagnosed, meaning that patients are diagnosed by their signs and symptoms in most cases. Viral nucleic acid RNA detection, viral antigen detection, and detection of antibodies to the COVID-19 virus are the tests that may be used for the detection of SARS-CoV-2. Both viral tests, RNA and antigen, for COVID-19 assess acute infection, while antibody tests give evidence of a previous infection with SARS-CoV-2. Prevention is the most effective management for influenza. Routine annual influenza vaccination for all persons aged 6 months and above is recommended, preferably before the onset of influenza in the community. Preventive measures used for COVID-19 are the use of face mask outdoors, avoiding crowded spaces, hand washing, avoiding to touch your eye, nose, or mouth, physical distancing, coughing or sneezing within a bent elbow or tissue. There are multiple FDA licensed influenza vaccines produced annually to protect against the 3 or 4 flu viruses that scientists anticipate will circulate each year. There are 2 FDA Emergency Use Authorization (EUA) vaccines for COVID-19 presently. The options of care for flu involve use of approved antiviral drugs for chemoprophylaxis and/or treatment. The search for effective therapies for COVID-19, the present global pandemic, is still on. People at high risk of infection, of complications, or who have been hospitalized for flu or COVID-19 should receive supportive medical care to help relieve symptoms and complications. In conclusion, there are similarities in the signs, symptoms, and complications of flu and COVID-19. It is important to practice preventive measures to avoid any of these respiratory illnesses and very necessary to adhere to the COVID-19 protocols in order to reduce the burden of the present pandemic. Have a lovely day. Bye.